The musculoskeletal system in humans consists of two parts. There is the spine, and there are the joints. This second part, just like the spine, often suffers as people age due to poor blood flow and poor nutrition. Right now, I want to point out that a very large number of people have joint problems. Statistics show that, on their own, joints only bother about 30% of people under 40. And mostly, joint diseases at that age are acute. These are arthritis and collapse injuries. A person gets these as a result of a joint injury, whether it's from sports, work, or even just everyday life. And these kinds of conditions are short-term. They don't last long. Basically, they go away once the inflammatory process stops, after which the joint recovers and works normally again. Young people generally don't have joint problems. But the situation is different when you look at the statistics for joint issues after the age of 40. Almost 70% of people are affected. Why does this happen? Starting around the age of 40, as we age, the blood supply to the joints worsens, and the joints themselves age and wear out. By the age of 70, 70% of people have joint problems, and amazingly, after 70, the chance of having joint issues rises to 90 or even 95%. The statistics on joint diseases are really alarming, and what's worse is that the treatment is often poor, and people don't fully understand how the disease develops, how to preserve their joints, or how to restore them. That's why today I want to talk about how a joint is structured, why it gets damaged, what you can do to prevent joint problems, and how to recover if your joints are already damaged. First, let's figure out what a joint actually is. In humans, a joint is where two or more bones connect at a place where the bones can move relative to each other. If the bones are fused together and can't move, that's not considered a joint, and there must be at least two bones involved. For example, the elbow joint is where the humerus and the two forearm bones connect, allowing movement at that spot. Another example is the shoulder joint, where the scapula and the humerus come together and movement occurs in this joint. All human joints are generally divided into two categories, large joints, of which there are only 12, and small joints. The large joints are the shoulder, elbow, wrist, hip, knee, and ankle joints. All the other joints are small. They get affected differently and are structured a bit differently. All human joints share a common structural plan. For a joint to exist, there must be two or more bones. Let me give you an example of a very simple joint that consists of two bones. The main requirement for a joint is that the bones must be able to move relative to each other at that spot. But in order to prevent the bones from wearing down during movement, as you can see here on the screen, the bones at the joint must be covered with some kind of protective material. For our joints, this protective material is cartilage. And at the point where the bones connect, they are always covered with cartilage. Movement and friction occur only between the cartilages. But even here, there will inevitably be friction between the cartilage surfaces. And just like in any mechanism, in any engine where there is movement, to prevent the cartilage from wearing down between the two cartilage surfaces in the joint, there is always joint fluid, synovial fluid, a lubricant. It is always present, filling the space between the two cartilage surfaces. But in order for this synovial fluid not to leak out of the joint, just like any other mechanism, must be sealed tightly. To keep the joint closed, there is a joint capsule. It's called the joint capsule, or bursa in Latin. This joint capsule must always remain airtight in a person. And this joint capsule protects the joint from drying out, ensuring that the joint lubricant always stays inside the joint. Where does the lubricant come from? The lubricant is produced by the synovial membrane located on the wall of the joint capsule. The synovial membrane continuously produces this lubricant throughout a person's life, keeping the joint coated with lubricating fluid. But the synovial membrane, you can see it right here on the screen, only produces lubricant when enough blood is, in fact, actually delivered to our joint through the arteries. So, the situation is that as long as enough blood reaches our joint, a sufficient amount of lubricant will always be produced in the joint. If the joint is well lubricated and functions properly, it will remain healthy for a person throughout their life. The problem starts exactly when there is no longer enough blood supply to the joint. Take a look at another example, a hip joint. In the hip joint, just like in the knee, there are two bones, and to prevent the bones from wearing down, they are always covered with cartilage at this spot. The pink areas on the screen. To keep the cartilage from wearing down, there is synovial fluid, shown in yellow, between the two pieces of cartilage. To prevent the fluid from leaking out, the entire joint is enclosed in a joint capsule. And the capsule holds the fluid in, keeping it from escaping. But for the capsule, or more precisely, for the synovial membrane on the capsule to produce fluid, blood must reach the joint through the arteries. That's the general structure of our joints. So how do our joints get sick? The main and most common disease that affects the joints is arthritis. The word arthrosis itself comes from the Greek word for joint. Itis is a suffix that always means inflammation. All inflammatory conditions in our language end with itis. So, arthritis is an inflammatory process in the joint itself. Inflammation in the joint. Usually, all the signs of inflammation appear. You can see the typical ones in the picture. There is always redness, definitely swelling, sharp and severe pain in that area, increased temperature, and the joint becomes less mobile. Such arthritis can occur either after a joint injury, or it can also develop in cases of rheumatism or rheumatic diseases, when there is an autoimmune inflammation of the joint. But arthritis is considered an acute condition. More often, especially in older people, another condition develops, arthrosis. This is a degenerative dystrophic process, and many people don't fully understand what the word arthrosis actually means. The term degenerative dystrophic process in Latin doesn't really help people understand, it just suggests that the joint is worn out. But in fact, with a proper literary translation, this word means aging of the joint due to poor blood circulation. So, it turns out that a person's joint becomes old and wears out because blood doesn't flow well to the joint. All the other terminology related to this topic specifically refers to arthrosis. For example, when the hip joint ages, it's called coxarthrosis. When the knee joint ages, it's called gunarthrosis. If the small joints are affected, like those in the hands or feet, the condition is called polyarthritis. If joint wear leads to bone damage, then it's called osteoarthritis, or if deformity occurs, osteoarthritis becomes deforming osteoarthritis. I'm emphasizing this because I want you to understand the meaning of these terms. So why does a person develop arthrosis? Why does the joint wear out? Why does 70% of people between the ages of 40 and 70 develop arthrosis? Arthrosis is a vascular disease. The problem, the cause of arthrosis, is a disruption in the blood supply to the joint. The thing is, vascular problems that develop in the human body lead to a decrease in the number of blood vessels and capillaries that supply blood to the joint as we age. As a result of hypertension, blood pressure issues, vegetative vascular dystonia, atherosclerotic changes in the blood vessels, clogged vessels, and other problems related to our cardiovascular system, less blood starts to flow to the joint as we age. If less blood reaches the joint, the synovial membrane in the joint will produce less lubrication. If less lubrication is produced in the joint will start to operate dry. And then the first symptom of a joint operating dry is creaking, noise, or crunching sounds during movement in the joint. This creaking, this crunching already means that the engine, the joint, our mechanism is running dry, without lubrication. And at this point, cartilage is rubbing against cartilage dry, leading to damage, significant, large-scale destruction of the cartilage itself. As people age, their joints start to crack or crunch. This is already a sign of osteoarthritis. This already means that the cartilage is wearing down, that the joint is running dry, and the cartilage is being destroyed at this moment. It's somewhat similar to a car engine. The oil warning light comes on. There's already no oil left in the engine, but unlike an engine, which we monitor closely, people often miss this moment with their joints, and they think, well, it creaks, but it doesn't hurt. And the whole problem is that it doesn't hurt, because people miss the most important stage of joint disease, when the situation can still be fixed. At the second stage, when the cartilage has already worn down due to constant friction, the cartilage gets so eroded that bone starts rubbing against bone. Bone on bone, the periosteum, it has nerve endings. So, when a person's bones start rubbing against each other, that's when they feel pain for the first time. Pain is a signal that the cartilage has worn away. Pain is a signal that damage is already happening, bone against bone. That's when, for the first time, a person starts to think that something is wrong with their joint. Because now there's pain, now there's a real problem. The person goes to the doctor. But when pain has already set in, it means the cartilage has worn away, the cartilage is being destroyed, and bone is rubbing against bone. That's when arthrosis turns into osteoarthritis. To clarify, of course, a follow-up X-ray is done, but as a result, it turns out that the person's cartilage is already worn down. The person is already experiencing damage even to the bones. Very often, people have bone damage. As you can see here on the screen, this leads to joint deformity, deforming osteoarthritis. And in such cases, you often hear from the doctor that only surgery can help. They say you need a joint replacement. The cartilage is worn out, and cartilage can no longer regenerate, but all of this information isn't entirely accurate. And now I want to explain exactly how you can and should restore your joints, even when your cartilage has already worn down. When faced with the problem of joint osteoarthritis, a person, like a hero from a Russian epic, comes to a crossroads and encounters a variety of options for how to address osteoarthritis. There are several ways to solve the problem of osteoarthritis. You can undergo surgery to replace the joint, you can try medication, or you can turn to medical equipment to address the issue with the help of technology. There is the dumbest, most incorrect option of all, just not treating it and leaving everything as it is. Let's take a closer look at these options together now. If you go to the left, you'll end up having surgery. What does surgery involve? Surgery to replace a joint is called endoprosthesis, and it involves replacing our knee, hip, or other joints. At this point, the damaged part of the joint, the articular surface, is cut off, and instead, as you can see here, a metal endoprosthesis like this one is installed. As a result, the person basically gets a new joint made of metal. But there are a few nuances. Very often, these joints and joint constructions are not very reliable. They often break and become unusable because of improper behavior by the person with the endoprosthesis. Very often, these joint constructions are too expensive for a person to purchase, especially when they're told that they need to be replaced after a few years. Therefore, if there is any possibility at all, I strongly suggest never replacing your joint and swapping your natural joint for an artificial one, if there is even the slightest chance to save your leg, to keep your own joint, if there is a way to restore and heal it. Because in many cases of joint replacement, from my personal experience, they ended up causing disability for the person, leading to situations where the person either dies during the operation, or is left immobile, severely immobile, or ends up in a wheelchair. The second option is medication-based treatment. But let's start with pain relief. The thing that is most often suggested is simply to take painkillers. Sometimes they're strong, sometimes, less strong. I don't want to talk right now about their destructive effects, but just relieving the pain symptom by itself will never restore the joint. This will not cure the joint. Neither ointments nor any other medications that have a distracting effect will ever make the joint healthy. They will only turn off the pain itself. Even if you use hormonal drugs, which are very powerful in their effect, they will only block the pain, but they won't stop the destruction of the joint or the bone. Chondroprotective drugs, which are now being heavily advertised in the media, deserve special attention. I have studied the use of chondroprotectors, and I am currently quite surprised by the state of affairs regarding the use of chondroprotectors as it stands now. After all, the word chondroprotector itself translates as protector of cartilage. Because by their very structure, hyaluronic acid and other components of cartilage tissue do not restore cartilage that has already been damaged. These drugs are only intended to slow down the destruction of cartilage a little bit. And scientific studies show that taking chondroprotectors over a long period of several consecutive years can halt or slow down the destruction of cartilage. But in no way can we say that they restore cartilage. That's why I still recommend using such medications, but it's important to clearly understand that their effect should be based primarily on protecting the cartilage, not on restoring it when it is already damaged. As for the other medications, antioxidants, vitamins, dietary supplements, I call them, frankly, just ways to flush money out of your wallet. There's one nuance that I always mention to people. Look, if blood has stopped reaching the joint and all the necessary components are no longer being delivered with the blood, then what component, what substance, what medication introduced into the bloodstream could possibly reach the joint? If blood isn't getting there, then no substance can actually reach the joint itself, and it won't help solve our problem. A separate issue in joint treatment is intra-articular injections, which are sometimes done to relieve pain in a particularly painful or stubborn joint. What are they? They involve a surgeon injecting a powerful anti-inflammatory substance directly into the joint, most often a hormonal drug like hydrocortisone or its analogs. As a result, this extremely strong anti-inflammatory effect inside the joint stops the inflammation and pain. The joint grinds bone on bone, raw, with nothing in between, but there's no pain, and the person doesn't feel any discomfort. Their joint is wearing away, but it doesn't hurt, so they think they're actually getting better. However, these injections actually lead to faster and more severe destruction of the joint itself. Historically, these injections have already outlived their usefulness, and today, in most cases, they are actually contraindicated for people. They are only used in the most extreme cases, because after such an injection, the joint will remain diseased and will continue to require more and more injections. And the fourth option, or rather, the fourth scenario, is simply not to treat it at all. What happens to a person if they don't treat their joints? Well, what develops is simply an advanced stage of the disease. At first, a person's knees hurt, they hurt, and hurt, and hurt. They hurt when you move, they hurt under load. Over time, the pain becomes constant, and you start to feel pain even at rest. Swelling of the joint develops, and inflammatory processes like arthrosis and arthritis also occur. Over time, contractures develop, mobility decreases, and even ankylosis can set in, meaning the joint becomes completely immobile. And after that comes disability. Then people become bedridden. Then come the adult diapers. And after that, things just keep getting worse and worse. There are constant expenses, and more treatments become contraindicated. It's kind of like the legendary Ostap bender. He wanted the best, but in the end, he only fooled himself. You should never ignore the problem. You need to address it and not just hope that it will go away on its own. When people say, maybe it will go away tomorrow or the day after, it kind of reminds me of when people say, once the cold weather ends and summer comes, winter will never return. Of course it will. The joint will keep deteriorating, the symptoms will only get worse, and each time it will become harder and harder to restore the joint. That's why you should never put off or neglect addressing the problem of osteoarthritis in your joints.